Hi, my name is Karen Hodges, and I'm a physical therapist in the Bay Area. I specialize in women's health, specifically pelvic floor physical therapy. I wanted to do a video today for education on techniques that I use for perineal stretching or perineal prep. It's especially helpful, research suggests, as well as what I've seen clinically with first-time vaginal deliveries. It can include a VBAC as well. Usually I recommend this to moms who are 35 or 36 weeks plus, just because there's not as good of carryover if you're doing it like in your first trimester all the way until your delivery. I recommend this every day, and it doesn't take long. It's actually a pretty straightforward technique. So hopefully you find this helpful. Let's orient here. So here's the pelvis. Here's pelvic organs from the top down. Here's from the bottom up. Sit bones on either side, pubic bone, tailbone, anal opening, vaginal opening, and then urethral opening in the front. What we're gonna be focusing on, if you're imagining kind of a clock, here's 12 o'clock, here's 6 o'clock, we're gonna be focusing on like 3 to 9 o'clock. That's the area that really needs to stretch back the most for a baby's cranium to exit during pushing. So what I usually recommend, and it can be done by moms themselves. I find it a little bit easier for partners to perform, just because then mom can focus on relaxing and using kind of a more functional technique of breathing that I'll teach you guys in this video. So wash your hands, use natural lubrication, something like coconut oil can even be effective, or any lubrication that you've used for vaginal penetration before that your body is good with. So what you're gonna do is you're gonna have either your partner or you are gonna lubricate. You can use gloves if you want to, of course. Lubricate the digit of your dominant hand first. The first finger, if it's your partner, your thumb, if it's yourself, just for orientation's sake. Let's say it's your partner that's doing it. So what they're gonna do is they're gonna go into the first knuckle and just go straight back and hold. Usually I recommend, a 2 or 3 out of 10 discomfort. You couldn't think about what you're making for dinner that night, but it's not like pushing you off the table. Then as they're holding straight back, your job is to just breathe and relax into the tension. So the breath work that you want to focus on is inhale, relaxing. Our diaphragm and our pelvic floor have a very intimate relationship, and that as you exhale, it facilitates a lift. As you inhale, it facilitates a lengthening. This is a perfect way to practice breathing techniques for labor. So when you're breathing in, you should feel, oh yeah, there's tension that's letting go from my partner's finger. Of course, if you're doing it, you're coming this way and you're pushing straight back and you're trying to use that same breathing technique. A little bit harder, but it can be done. 90 seconds there. In, relax, in, relax, in, relax. I would recommend just your partner holding the tension or you holding the tension, even if it does release the first couple times. And then if really the tension comes down to a 0, then you can increase the pressure as you're holding there. Following this, you're gonna lubricate, use gloves if you want to, either thumb, if you're doing it yourself, or the first finger on either hand, if your partner's doing it. Again, go into the level of the first knuckle, go at a diagonal, like a 45-degree diagonal, back and out, just like this. And you're gonna, same technique. Inhale to relax your pelvic floor down. Exhale, just try to keep normal resting tension that you started with. Inhale, relax down. Think of, in hypnobirthing, I think they use the phrase breathing the baby down. That's kind of what you're thinking of. As you're breathing into the tension, you're thinking of letting go and breathing baby down rather than resisting and fighting against it. And this is what I feel like keeps the carryover rather than just doing an outright stretch, but breathing and trying to use your breath to facilitate the relaxation. I hope this is helpful.